Hey everyone, Zach Greenway here at Performance Sport and Spine, and today we're going to go over some exercises that you can use to reintroduce movement into your low back after an acute back episode. So anyone that's ever experienced a low back episode, you can realize that the back is very tight and lots of motions and different twists can be very painful. So here's some exercises and different variations that you can try to do to kind of start reintroducing motion. Some will work for you, some won't. It really depends on the person. So we're going to give you a bunch of options and you can kind of figure out what works for you. The first one we're going to start is in the sagittal plane, the front and back. So what you're going to do is get on your hands and knees and you're just going to kind of roll your pelvis one way and then the opposite. Again, it's subtle, small motions, and you might find that as you do each rep, it gets a little bit less painful and a little better. Now, if that's too uncomfortable or not tolerated well, you can kind of just rock back and forth on your hands and knees. Sometimes you might find that laying on your back and doing the same thing where you roll your pelvis one way and then another way is more tolerated. Some people might find it more painful. Again, you'll have to use a trial and error method. Another thing that can maybe be helpful is by using your glutes and your abs to kind of squeeze to make the motion happen more from those muscles and regions than your low back. Next, we're going to do some exercises in the rotation plane. So the first one we're going to try to do is, again, being on our hands and knees, you're going to kind of let your pelvis slide to one side and then the opposite side. Again, as you do each rep, try to find that you can go a little bit farther. Sometimes this feels better. Again, sometimes it feels worse. If this doesn't seem like it's tolerated very well, again, you can lay on your back and then roll your hips and pelvis from side to side. Sometimes, again, this is even too much. So you might find just using like one leg at a time to start with, or you can put your hands up and limit your range of motion as you do it. And again, the goal is to kind of increase range of motion, and it may be a little bit painful, but it should be to tolerance. Next, we're going to work on the side-to-side range of motion. So you're going to be kind of against the wall, and you can kind of pick up one hip and then the other, as well as kind of laterally bending the low back to that side. Now again, sometimes it's going to hurt too much, so you might just raise your heel and bend, keeping that foot on the ground, or you can lay on your back again and just kind of hike one hip towards your shoulders. Sometimes bending the knee and sliding the foot along the ground is helpful, and sometimes it's better just to kind of raise your hip. There is no fix-all for this, so there's just different options that you can explore. We hope you found this video helpful and it helps give you some options on how to restore and reintroduce movement into the low back. Low back pain is often very painful but rarely serious. However, this video is not meant for medical advice, purely for educational purposes.